So let's bring in emergency medicine physician Dr. Hilary Fairbrother to discuss the very latest in COVID news. So thank you so much for joining us. What do we know about this fourth dose of COVID vaccine?
Well, it will be the same level dose of the same mRNA vaccine that we've seen, and it's only set to apply to a very small portion of the population. So about 2 to 3% of Americans have what's considered severe immunocompromised. So maybe they've had a transplant and they have to take anti-rejection drugs, they're on active chemotherapy and radiation for cancer, or have an immunocompromising disease like severe HIV or AIDS. So for those patients, it is really hard because their immune system is one of their primary healthcare problems. It is really hard for them to have lasting immunity after they get a vaccine. And so because of that, and that's really every vaccine, but we're seeing that with the coronavirus vaccine as well. So what they have proposed is 6 months after any booster or 6 months after the third shot, that anyone who got the COVID vaccine through Moderna or Pfizer would be therefore eligible for a fourth shot to really help improve their immunity overall.
So, Dr. Fairbrother, that was going to be my question. So for the rest of us who are not immunocompromised, a booster, once it's available to us, should be all that we need until when? Another year? Will it be a yearly shot? Because, for example, if I use myself as a specific example, I got my first shot in March and my second in April. So I'm guessing I'm sort of due for a booster, right? And then when would I need the second booster? Like, when would I, or would I even need it at all?
So this has been really hard, and I know that the messaging has been really confusing about this. And I want to kind of focus on a couple things. So clearly, boosters are safe, and some people in our communities need them sooner than others because of the health problems that they have. But for the rest of us who have, we're not super old and we don't have too many medical problems, but we really don't want to get coronavirus, and we certainly don't want to get severely ill or die of coronavirus. And so the best way of avoiding that is to get vaccinated. And the mRNA vaccines are Pfizer and Moderna. That's a 2-vaccine process. Well, so what has been noted is that with time, some of the effectiveness of that vaccine wanes, and our immune system probably needs this booster shot. And there's been a lot of controversy over that, and we could go into that for days. But the reality is that boosters are safe, and most of us are going to get a booster between 6 and 9 months after our second shot. And this really helps boost our immunity and really make it so that we are back to that 90% range of not even getting symptoms when we are exposed to COVID and coronavirus. So yes, you are correct. You are probably getting close to eligibility for your booster status. Now, when we think about the world, this whole discussion gets a lot more complex, and there are some people saying, do we really need booster shots? And I think that that's an interesting discussion. But in general, booster shots are safe, and we're going to be seeing that most people are getting them between 6 and 9 months after their second shot of either Moderna or Pfizer. Now, that's a little bit different for anyone who got the J&J shot. Because that one's a little less effective, we're really encouraging everyone to go out and get a booster of any shot, the J&J, the Moderna, or the Pfizer, really as soon as possible, really to make sure that patients are protected against coronavirus if their first shot was the J&J.
So the FDA could authorize emergency use of the Pfizer vaccine for children ages 5 to 11 in the coming days. We know that the dose would be a smaller dose, I think a third of the size of the adult version. You're in Texas. How are hospitals in Texas preparing for this kid-sized vaccine?
So the nice thing about these vaccines is that they were always in these multi-dose vials. So we can pull up the recommended dose for the 5 to 11-year-olds very easily. And it is a third of the dose that's recommended for patients who are 12 and older. So the patients who are 12 to 17, they got the same dose as adults. But children who are 5 to 11, and I do believe in the next couple days, we'll see this come out as recommendation. that these younger children will get a third of the dose. It is still a 2-shot series, and there is still 3 weeks in between the shot. So everything is the same. It's just a smaller dose. And it really has been shown to prevent severe COVID and death by COVID and decreasing all of the bad things that go along with COVID in our children, in these children aged 5 to 11. So the data is very, very good and really was very convincing. It was a unanimous vote with 1 abstention when it was going through the FDA.
So some parents, as you can imagine, are hesitant to have their children get the shot. Even some vaccinated parents say they are not in a rush. What is your advice? What are you counseling your patients who might be unsure about child COVID vaccines?
So first of all, I want to just thank all the parents for caring so much about their kids. And I realize that when parents are worried about a vaccine or a possible vaccine reaction, that's because they love their children and they want what's best for their children. And I hope that that messaging has been clear from your public health officials and from your doctors. That being said, the COVID vaccine is safe for children. It really has been shown to be safe. The Pfizer data tested thousands of children and did not see a single case of a serious side effect. And that includes some of the side effects that we have seen associated with these vaccines. So the big thing everyone's always scared about right now is this myocarditis in particularly young boys or young men. And there is a very, very, very small chance of some of our young men and some of our younger patients getting myocarditis, particularly after the second shot. And I know, I'm a parent, that kind of information always gives parents and really everyone pause. Unfortunately, the grim reality is that the risk of COVID is 1,000 times higher to get myocarditis or other long symptoms of COVID or other severe symptoms of COVID. Now, COVID does not make children violently ill for the most part, but it does make children, some of them, a very small number, but some of them get very sick. And it is preventable with this vaccine. So I encourage every parent to really obviously consider what is best for their family, but I would very much encourage them to get their children vaccinated. I will certainly be getting my children vaccinated. It is an important decision for any parent, but it is safe. And I just want to be clear that I appreciate parents caring for their kids, but this is really the wave of the future in making sure that our children do not continue to suffer from long COVID symptoms and from severe COVID virus and hospitalization, and unfortunately, sometimes even death.
Dr. Hilary Fairbrother, thank you so very much for your insight and analysis. We appreciate it. I also appreciate your comment about being super old. I don't know if I'm super old, but some days I feel super old. So we'll have to see how that factors into what I do next. We appreciate it as always.
Well, go get your booster.
All right. That tells me that tells me everything I need to know. Good to see you.